Good afternoon, everyone, and welcome to the COVID-19 update for Wednesday, December the 2nd. Today marks a solemn milestone, with 238 lives lost to COVID-19 reported in the last 24 hours. We have far surpassed our previous single-day high report of 191 fatalities in mid-May. And while it's likely that some of this increase can be attributed to a data lag from the holiday weekend, we also know that higher case numbers and higher numbers of hospitalizations do lead to, tragically, even more lives lost. And we've surpassed the spring records by the thousands in recent weeks. We'll continue to watch these numbers closely in the coming weeks to have a better picture of our trajectory, but a life lost reported late following a holiday is still a life lost. To those 238 sets of families, friends, and loved ones, as well as the thousands more who preceded them, I offer my sincerest and my deepest condolences. This pandemic stole someone from your lives too soon. May their memories be for a blessing. This virus is a killer. Let's honor those that it has taken by doing everything that we can to prevent more people from getting sick and dying. Wear your mask. Keep your distance. Stay home whenever you can. We'll get through this. Today I want to focus on our healthcare workers. Doctors and nurses are the first people that we tend to think about when the media focuses on our healthcare heroes, but it goes so much deeper than that. Respiratory therapists, EMTs, housekeepers, operating engineers, food service workers, janitors, and administrative assistants. These are the people who are essential to caring for COVID-19 patients who come into our hospitals in need of medical treatment. Sometimes these are the people who keep patients company in their last hours of life. Today I want to put names and stories to those titles to remind us of the people who are on the front lines, the people that you're keeping safe when you wear a mask and you slow the spread of this virus. People like Pam Moore, the housekeeping leader at Catherine Shaw Bethea Hospital in Lee County. Pam tirelessly leads her staff through the task of cleaning COVID-19 occupied rooms from the emergency department to the operating room, making sure that everyone has the proper PPE and making it possible for the next patient to safely use that room. And remember, often these housekeepers are going into rooms when the patient is still in them, meaning that they're one of the limited faces that a patient might have contact with while actively battling COVID-19. In Centralia, Illinois, at SSM Health St. Mary's Hospital, that face might be Patty Box, an environmental services associate, housekeeping trainer, and she's the first person in the department to clean a COVID-positive room. In the words of her director, quote, "I couldn't have been prouder of the way she's been present and compassionate for her patients." And while Patty was nervous the first time that she went into a COVID-positive room, she did it all the same, knowing that this patient, that every patient, deserves the same clean and safe environment that every other patient deserves. Or Sarasama Mohanan, a respiratory therapist at Amita Health St. Mary's and Elizabeth Medical Center in Cook County, one of Chicago's largest safety net hospitals. Sarasama is known as someone who never complains and who always performs well above expectations, even if it means being the closest person to a positive patient, as being a respiratory therapist often demands. They're often the first ones to be called by nurses when a patient is having trouble breathing. They know more about oxygen and breathing support and ventilators than most others in the hospital. They work complex machines, use suction to remove obstructive secretions from an airway, take patients off of ventilators, and in many hospitals they even position the breathing tube in the first place. That means that respiratory therapists like Sarasama are probably doing more than most and going into more COVID-19 patient rooms than just about anybody else. Or people like Eric Tritch, Vice President for Supply Chain and Logistics at University of Chicago Medicine. Eric has been working around the clock, really, since January, when the hospital first stood up its Hospital Incident Command System to ensure the supply of personal protective equipment. Eric spearheaded numerous initiatives to ensure that staff had access to protective equipment, including UV re-sterilization of N95 masks, stocking strategies to reduce unnecessary burn rates of critical items, and sourcing strategies to ensure distribution of critical inventory. His efforts, and that of his team, prevented exposures of hospital personnel and protected the health and the safety of all individuals across their entire health system. And Terry McCrary, infection preventionist at OSF Healthcare's St. Mary's Medical Center in Galesburg. Terry educates others on how to best prevent the spread of COVID-19 within the facility. And she and her husband donated over 500 Heartseeker t-shirts to nurses to lift up their spirits when COVID-19 first appeared in March of this year. Terry, Eric, Sarasama, Patty, and Pam, all of them didn't ring in the new year on January 1st, 2020, thinking that they would spend it working double shifts, multiple days a week, in the middle of the worst health crisis in over a century. They too have families they worry about. They too are exhausted. They too wish that they could take off their mask as they leave the hospital, go out to eat with family and friends in a room full of strangers, or just hug their relatives without worry. Our public health mitigations are meant to keep our hospitals and our hospital personnel from being overrun by COVID-19 patients. The best way to protect the people who take care of us when we get sick is to wear a mask, keep your distance, wash your hands, and get your flu shot. It's our individual responsibility to get ourselves through this without getting the virus, so Terry and Eric and Sarasama and Patty and Pam can get through this too. So thank you, and with that I'd like to turn it over to Dr. Ngozi Ezike.
Hello, good afternoon. Governor Pritzker, thank you for being guided by science and data throughout this pandemic. And it's been a hard 9 months for everyone, but if we all remain committed to following the guidance from the CDC and other experts, we will be successful in this fight against COVID-19. Dr. Fauci said towards the beginning of this pandemic that the true opposing force to the novel coronavirus was us. And this was, again, early in the pandemic when we were still learning so much about the severity and the treatments and the virus itself. But recently he said there's a new opposing force to this deadly virus, and that is the vaccine. Outbreaks of diseases like polio, like smallpox, measles, those have been eradicated due to vaccines. Vaccines are the best invention in medicine of the 20th century. With COVID-19, its eradication is dependent on those who are able to get vaccinated to truly be protected and then get back to normal. Until then, we have to continue to practice our 3 Ws each and every day, especially throughout the upcoming holidays. Please continue to wear your mask, wash your hands, and watch your distance. These mitigation measures do work. In the last 24 hours, over 85,000 tests have been reported for a total of 10.6 million tests performed in Illinois. 9,757 individuals were newly diagnosed with COVID-19. for a total of 748,603 total individuals in the state of Illinois diagnosed with COVID-19. Unfortunately, as the governor mentioned, 238 lives were reported lost to IDPH in the last 24 hours, for a total of 12,639 deaths. In the hospitals overnight across our state, 5,764 were in beds with COVID-19, and of those, 1,190 were in the ICU, and of those, 714 were on ventilators. Let's not make this holiday season anyone's last holiday season. Let's stay the course and fight for everyone's life. We can all enjoy together and safely. Let's make the holidays less harrowing, not just for the people who might end up sick and in the hospital with COVID or non-COVID illnesses, but also for the staff that will tend to all those COVID as well as non-COVID patients. I ask every Illinoisan to do their part in getting through this pandemic. We've already lost too many lives. Yes, we've lost our normalcy, but we shouldn't lose hope. We'll work together, and we will prevent the spread of this virus, and we can do that by masking up, washing up, and backing up. Thank you. Buenas tardes a todos. Gracias a ti, Gobernador Pritzker, por ser guiado siempre en la ciencia y los datos durante esta pandemia. Han sido 9 meses difíciles para todos, pero si todos mantenemos el compromiso de seguir la guía de CDC y otros expertos, tendremos éxito en nuestra lucha contra COVID-19. El doctor Anthony Fauci dijo que la única verdadera fuerza contra el nuevo coronavirus somos nosotros. Esto fue al principio de la pandemia, cuando todavía estábamos aprendiendo mucho sobre la gravedad, los tratamientos y en general por el virus. Pero como dijo recientemente el Dr. Fauci, existe otra fuerza contra este virus mortal, y esa es la vacuna. Los brotes de enfermedades como la poliomielitis, la viruela y el sarampión han sido prácticamente erradicados gracias a las vacunas. COVID-19 no es diferente, pero su erradicación depende de que todos nos vacunemos para estar protegidos y volver a la normalidad. Hasta este tiempo, todos debemos continuar con nuestras medidas de seguridad de salud pública. Están demostrados que funcionan. No importa lo que las redes sociales trabajan. En las últimas 24 horas, más de 85,000 pruebas de COVID-19 fueron hechas para un total de más de 10.6 millones de pruebas aquí en Illinois. Desde ayer se han reportado 9,757 nuevos casos, esas nuevas personas en Illinois de COVID-19, para un total de más de 748,000 casos en Illinois. También hay 238 vidas perdidas, para un total de más de 12,600 muertes en Illinois. 5,764 personas pasaron la noche en el hospital con COVID-19 y de ellos 1,190 pacientes estaban en las unidades de cuidados intensivos y 714 pacientes estaban en ventiladores. No hagamos que esta temporada navideña sea la última. Hay que mantener el rumbo para que el próximo año sea algo que todos podemos disfrutar juntos. Le pido a toda la gente de Illinois que hagan su parte para superar esta pandemia. Hemos perdido vidas y perdido la normalidad, pero no debemos perder la esperanza. Tenemos que trabajar juntos para prevenir la propagación de COVID-19 en nuestro estado, porque no puede hacerlo solos. Debemos hacerlo juntos. Muchísimas gracias. And with that, I'll turn it over to Governor Pritzker.
I'd like to introduce our next speaker, coming to us live from Metro East near St. Louis. As the hospitalist medical director at Anderson Hospital, Dr. Christopher Farrar has seen firsthand the impact of COVID-19 on his hospital and their ability to serve all patients, COVID-19 and otherwise, throughout this pandemic. He's here to remind all of us that our amazing hospital systems are not quite infinite. And we've got to do our best to reduce the spread by staying home as they can do their jobs and so they can save lives. Dr. Farrar, I'd like to turn it over to you.
Hello, thank you for inviting me to speak today at the Governor's press conference regarding the COVID-19 pandemic. I'm Dr. Christopher Farrar. I'm a graduate of Dartmouth Medical School and a board-certified physician in internal medicine. I've been practicing medicine for over 20 years, and I'm currently the hospitalist medical director at Anderson Hospital, located in Maryville, Illinois, in the Metro East St. Louis area. At Anderson Hospital and around our region, we're seeing a large spike in cases of COVID-19. This has translated into increasing hospitalizations and deaths. Make no mistake, this is a terrible disease that can affect so many different organ systems, causing pain and suffering that can last weeks. The long-term impact on the human body is yet unknown. This recent spike in cases has put a strain on the number of available hospital beds, and in particular Icu beds, which could impact the care of patients, including those who have non-COVID life-threatening illnesses. As a provider on the front lines of this pandemic, I've witnessed the misery and death this virus inflicts on my patients and the emotional toll on their families. Because of COVID-19, families now are no longer able to visit their loved ones in the hospital. We are now having emotional phone calls with families, providing treatment updates and discussing options, including end-of-life care. My team and I have cared for many patients with COVID-19, some of whom have been lost to this disease. Despite the strain on my medical staff, we continue to provide exceptional care to our patients. As the medical director, I have the honor and privilege of working with an extraordinary group of caring and compassionate providers. These are extremely challenging times. Anderson Hospital has met this challenge due to the hard work and dedication of our healthcare family. My providers and the hospital staff have stepped up to take on this new wave of COVID-19 cases, and I want to ensure the public that we as healthcare providers will continue to help, support, and care for you and your loved ones if the need arises. I would like to emphasize, please do all you can to prevent this need from arising. I would ask the public, please use the recommended public health measures of mask wearing, hand washing, and social distancing to ensure that you and your family stay safe and healthy, which in turn reduces strain on the medical community. I'd like to thank the governor and his staff for their leadership during this unprecedented global crisis. And now I'd like to ask Governor Pritzker back to the podium for questions from the press. Thank you.
Thank you very much, Dr. Farrar. And I just want to say what a great hospital Anderson Hospital is and what great job they are serving the people of Metro East. They've been partners in our dealing with COVID-19 from the very, very beginning. Our pandemic response could not have been as strong as it is without Dr. Farrar and his cohort at Anderson Hospital. And I just, again, want to express my gratitude to him. Thank you, and happy to take questions from members of the media.
Governor,
Yes,
is
sir.
there any sense of how many of the deaths that were reported today may have been part of that lag in data?
It's hard to tell right now. We absolutely are looking at that to wonder, are there deaths that weren't reported from over the weekend or on Monday that are now being reported late? It's very hard to tell with the initial information that we get, but I know that the staff at IDPH always is looking at that. Even back in the spring, the 191 peak really was a conglomerate of a couple of days of data that came in. It's just a fact of life that hospitals don't all report exactly the same or exactly on time. Whenever IDPH gets the information, they report it to you so that you get it all as fast as we get it.
I wanted to get your impression on the new CDC guidance on quarantine from 14 to 10 days if you haven't gotten tested. I mean, for months now, Doctor, you've been saying that a fair number of people test positive day 10 to day 14. Is this a watering down of prudent measures?
Right. So there's a phrase, I guess, don't let perfect be the enemy of the good. And I think that's the goal here in trying to adjust these guidelines. We do know that there are people that may exhibit symptoms maybe from day 10 to 14, but I've always said that the majority, which is why we encourage people to test after a high-risk exposure, to test at day 7, because the majority of infections are detected then. So if you stop quarantine, and again, if we read the guidance carefully, it says, you can stop quarantine at 10 days, but you're encouraged to still, obviously take all the prudent measures, for the remaining 14 days. And so you still want to, continue to keep your distance, continue to wear masks, do all those great things. But the amount of infection that could happen in that 10 to 14 days, again, with more data collected over the length of this pandemic, they see that it's maybe 1% up to 10%. So yeah, we're foregoing the possibility of missing a few infections, but thinking that maybe when you don't say 14 days, and if you say 10 days, or you use the test out option with 7 days, that you'll have more adherence. And so maybe overall, we're still going to be further ahead because more people will actually comply. So that's, I think, where we're at.
But does this send the wrong message at this time of year? I mean, we just came off of Thanksgiving when, a lot of people did travel.
Again, if everybody does the 10 days where they're quarantining for those 10 days, we will get 90 to 99% of those infections. Would I like to get 100? Of course, but if we can get 90 to 99, I think we're still ahead of the game, as opposed to people who don't do any quarantine at all, and then those people are still running around transmitting the virus to others.
Just one question about hospital. I was on the website. Icu bed availability statewide is now below 20%. I think it's at 18 point something. Do you have an update just on what hospitals are doing regarding bypass, regarding elective procedures? What is on the table? What's being considered by IPH?
Yeah, so again, remembering that if we're about at 18%, that means there are beds, right? So that there are beds in all regions of the state, but there are individual hospitals. I got a report last night, the days mixed together, last night or this morning, saying, speaking of a hospital that has had quite a few people in the emergency room for an extended period of time. But it doesn't, so they're working on transferring, because like I said, even at 18%, that means there are some beds in some places, but it is getting tight. So, but that particular hospital, full, people have been in the ED for many days now, waiting for either a bed to open up or to be transferred out. So we do know that this is a real problem. 18% is not comforting as we worry about whatever may come from the Thanksgiving. And we have normal illnesses that occur now, heart attacks, strokes, all the regular things that would take someone to the hospital. We want to have a bed for everyone who gets sick, and so we don't like the idea of the numbers going down. And again, that's where all the mitigation measures that we're asking people to do, quarantine if you have been exposed, isolate if you've actually been infected, so that we don't create more people who may need a bed.
Anything else? Okay, we'll go online. John O'Connor at the AP is asking about price gouging. You promised twice that price gouging would not be tolerated. Granted, your focus is on ending the pandemic, but when will the public see the referral to the Attorney General you promised? For example, taxpayers paid $9.95 per N95 mask from Kimberly-Clark, a well-known company which is easy to find. Other N95 mask orders were for as little as 39 cents a piece. Thermometers ranged from $225 a piece to $150 each. When will you take the action you promised?
Well, I want to remind John who takes action on those items. We refer items certainly to the Attorney General as we're aware of them, but the public, the purchasers, for example, go to the Attorney General. The Attorney General, the state police, as well as federal authorities are responsible for investigating anybody who is price gouging in the process, in the occurrence of this pandemic. It is true, there no doubt there were PPE items that were sold at a much higher price than normally. I will say that early on, I think this was happening really all over the country because there really was a shortage. And there are many brokers that sit in between the manufacturers and people who are purchasing, like states. Had we had a DPA invoked the Defense Production Act by the President. Had we had the manufacturers working and sending directly PPE to the states, we would have been much better off. But yes, it is up to the enforcement authorities, particularly the AG, the state police, and the federal authorities to go after those price gougers.
Jim Haggerty with Rockford Advocate. Dr. Ezike, can you give us an update on how long COVID patients are staying in the hospital and the fatality rate among those who are placed on ventilators?
I can speak to the hospital length of stays. I've looked at that very recently. And I wanted to look at it because there is good news. We do know that you have a much better chance of surviving COVID-19 in the hospital now as opposed to wave 1. And so I looked at the difference between wave 1 and wave 2. And so the average length of stay was about 9 days, 9 to 11 days in wave 1, and it's about 7 to 9 for wave 2. So we've cut some time off. Again, you know that some stays are multiple weeks, even months, but the average has dropped. Of course, I also saw that in the long-term care population, those were longer hospitalizations, but they also shrunk by a day or two between wave 1 and wave 2. And again, I credit that to, a lot of the learning that was done from wave 1. We have a lot of therapeutics or plans that we know. We know about proning. We know about using steroids to help curb the cytokine, the hyperinflammatory response. We know that remdesivir, we think, decreases hospital stay, and now we have another tool in our armamentarium with the monoclonal antibodies, both the Regeneron product and the Eli Lilly product. That actually is not used in the hospital, but if it's used early in infection, can actually decrease the chances of people even going into the hospital or having severe illness. So I am so proud of our medical professionals and how they've come along and learned from their experience and are sharing that experience with others. But the idea, again, is always prevention, and let's avoid getting the infection in the first place, and again, doing that with the masking and distancing and avoiding places that you could be exposed by mixing households. Thank you.
Jake Griffin at the Daily Herald. Leaders of congregate care facilities are urging governors to place residents and staff at the head of the line over hospital workers for vaccines since they have been hardest hit by the virus. Why not follow this recommendation given the limited doses?
Well, actually, the recommendation from ACIP, which came yesterday, is to include in the same category the congregate care, long-term care facility residents and the workers there with healthcare workers in hospitals. So they'll get it simultaneously as the doses come in. And I'm pleased to say that in contrast to something that I said yesterday, we will not need to divide the number of doses that we receive in two, holding back half of them to give as the second dose for each person, because everybody who's getting the early vaccines that are available is getting 2 doses. You get 1 dose, and then 21 to 28 days later, you get a second dose. We don't have to hold back because of the speed at which we'll be receiving vaccines, and we're being told this, of course, by CDC and FDA, that we can, for example, with the 109,000 we hope to get from Pfizer between December 13th and 19th, we'll be able to put those into people's arms, 109,000 people, and then they'll be able to get the second dose of Pfizer 21 to 28 days later, those 109,000. So we will be able to serve more of the healthcare and long-term care facility people and do it at the same time.
This question is for Dr. Ezike from Ben Bradley at WGN. New IDPH provisional data show there have been more than 26,000 excess deaths through November 30th, but only half that number have been classified as COVID deaths. Why such a huge and increasing disparity?
Thank you, Ben. The numbers I have for excess deaths, I don't have numbers that high. I think from the beginning of the year, I have the excess death total at about 13 to 17,000, so 26 is a little bit higher. I'm not sure where the source for his stats. So, and I think we've talked about this before. We have deaths that we can attribute to COVID, and then we have these excess deaths. And so these excess deaths, what are they? They could be, oh, maybe he's combining the COVID deaths with what I'm calling the excess deaths to get to 26. So yeah, we're on the same page. So this balance, the 13 to 17 additional thousand deaths, what are those? Maybe early on in the pandemics, those were COVID deaths that were not recognized because we didn't have as much testing. Maybe those were deaths of people who, delayed care because of the fear around COVID. There are a lot of things that have to be sorted out, but we do know that we have had a lot of excess death. Can't all be explained by COVID. And again, this pandemic has caused all of this, and it is a tragedy. Beyond the almost 13,000 lives lost to COVID, there have been so many additional lives that have been lost as a result of COVID as well. And so, again, it's in all of our interest to move forward and do all the things we need to do to move forward, because we don't want to keep expending lives at the cost of, our families and friends.
Annalisa from the Pantograph in Bloomington. What is the administration doing to work with governors of neighboring states on a unified COVID response and consistent restrictions?
Well, I appreciate that. I know that people have asked that question all along. I talk to Midwestern governors very frequently. We have a regular set of calls, not just between the governors, Republican and Democrat, across the Midwest, but also our chiefs of staff have regular calls with one another, sharing best ideas. I would venture to say that Dr. Ezike talks to perhaps the most number of states of all, and their health leaders to get best ideas. But that's really what we're doing. We're sharing our best practices and best ideas, and those do come out in the policies that we're issuing. Each state is a little bit different, so it's obviously each governor is making a slightly different decision. But I will say that there is a commonality of the challenges and somewhat a commonality of what it will take to deal with those challenges, even though certainly from one state to another you see a lot of differences. Remember, in Wisconsin, for example, the governor of Wisconsin has had all of his ability to impose mitigations taken away by the Republican legislature and the Republican Supreme Court there. So that obviously causes more challenges for him than it does for us here in Illinois or even in Michigan. Although they too have had the Republican legislature and the Supreme Court take away some of their ability to impose mitigations.
Dave Dahl, WTAX. Governor, you are the leader of the state and allowed to have an opinion on this. Should the legislature in 2020 be able to meet virtually? Why or why not?
I'm allowed to have an opinion. I appreciate that. I didn't realize there was any restriction on that. They do. I think that the Senate, the House voted it down, as you know. The Senate put it in its rules to allow them to have virtual hearings. And we have appeared, in fact, in some of those virtual hearings, for example, just to answer questions for senators as that we normally would in committee hearings. So, I think it's a good idea. I wish the legislature was doing more of it. And, and in some cases, obviously, the hearings and the legislators themselves can be a great deal of help gathering as they do virtually. But I know that that's a challenge that the House has chosen not to take up.
Madison O'Brien, are all regions supposed to be following the Tier 3 mitigations right now? Some counties have taken their own approach and have not been enforcing all of the rules. Why is it important that every region is following the same rules?
Because we have a widespread problem of community spread and infection across the entire state of Illinois. There are no boundaries for this virus. So you may think that you live in a county that is less susceptible somehow to the virus because you may have a lower number of cases or a lower number of deaths in your county or in your city. The reality is that the virus, as we saw early on in the pandemic, there were rural areas of Illinois that felt like they were immune because they just weren't seeing much of the virus. We were saying all along This thing doesn't know any boundaries. It's coming to you. Be careful, follow the mitigations. And of course, now we see that rural areas are even more likely to have high infection rates and high death rates than urban areas.
Amy Jacobson, Governor, a number of Americans are leery of a COVID vaccine, and some are asking for lawmakers to get vaccinated first. Would you and Dr. Ezike be willing to do this?
Sure, but I wouldn't want to jump ahead of somebody who may be more at risk than I am. But absolutely, I understand exactly the point that's being made. There are competing views. There are some people who want their communities to be moved to the front of the line, and some people from those same communities would say they don't want to take the virus at all, the vaccine at all, rather. And so, you know, we're listening to the medical ethicists, we're listening to the epidemiologists to make sure that we're providing the vaccine, making it available to everybody that wants to have it as fast as we humanly possibly can. And of course, messaging to people will be very important. I'm not a doctor. I didn't review the materials that the FDA is reviewing now and won't be responsible for making the decisions that the FDA will make about the EUA for Pfizer, the EUA emergency use authorization for Moderna and others. But I do know that there are tens of thousands of patients who are in their trials, and so the results of those very widespread trials will be important to look at to determine whether or not these vaccines are safe. I feel somewhat confident that the quality of the people who serve on the panels at the FDA is such that they would make the right kind of decision for the American people. And here in Illinois, of course, we have a vaccine advisory team that will be reviewing that very same data right after it is released. The White House Coronavirus Task Force, I might add, had a meeting that that all the governors were part of just 2 days ago, and the head of the FDA, Hahn, said that all of the materials would be made available to all of us to review. So I do believe that it will be safe. We'll be able to review the data to confirm that, and I hope that people will therefore get the vaccine as they are able to see that it's safe.
Hannah Mizell has a couple questions on LaSalle. I'll break them up so you can get both of them. When the DHS Inspector General's report on the LaSalle Veterans Home on the COVID outbreak is completed, will you commit to releasing it without redactions other than personal information for the home's residents?
Of course. I mean, what I think is that I want full transparency. I mean, the whole idea here is let's figure out what went wrong so that we can not only hold people accountable, which I know is what everybody's talking about, but also because we want to make changes if there are changes that need to be made at our long-term care facilities across the state or specifically at our veterans' homes. So, you know, it's my job to make sure that we act upon those, and certainly I want to make sure that the public is aware.
Additionally, Veterans Affairs Director Chapelivia said last week during a Senate hearing on the outbreak that she had not spoken to you personally. Have you spoken to her since, and what directives have you or Deputy Governor Sol Flores given her?
I have spoken with her, and the most important thing that we've directed Director Chapelivia to do, which she already is doing, is to make sure she takes care of those veterans in every way that she can and their families. We have veterans who not only have contracted COVID-19 and survived and are recovering, we have those who are still ill and in the hospital, and of course those who have passed away. And we want to make sure that she does everything to take care of them. At the same time, we want to make sure that every precaution is being taken. If there are any procedures that we are already aware of that were not being followed, we want those corrected. And we already know of one that was discovered by both the state Veterans Affairs Department as well as the federal Veterans Affairs Department, which did an inspection together weeks ago, which was in some dispensers, their hand sanitizer dispensers, thank you, that there was a hand sanitizer that wasn't as effective as the kind that's recommended for dealing with COVID-19. There were other hand sanitizer dispensers that are tabletop style that were exactly the right type. Obviously, the ones that are attached to the wall that didn't have the right type, all of those have been replaced, as I understand, at least the type of hand sanitizer has. That's one example of something that was discovered as a result of the work that Director Chapelavia is doing.
Dan Petrella at the Tribune. Does Dr. Ezike have a current projection for how many total deaths we're likely to see by the end of the year based on the current trajectory?
I would like to say that I don't have that projection because the trajectory will change because people will fully adopt these mitigation measures that will change the trajectory and drop the numbers significantly. The amount of that drop, again, will be determined by every individual Illinoisan that takes up these appropriate measures. And so I'm looking forward to really having lower numbers than what might be expected by modelers. But again, it takes every single person. I really want to emphasize how much people have the power of life and death in their hands, in their mask, in their ability to say no to large gatherings, and their ability to say no to venues that would promote the spread of this virus. So I urge everyone to give the gift of life this holiday season by being as safe as possible and making a safer environment for everyone around us.
Lynn Sweet at the Sun-Times wants to know how your call with the federal delegation went today.
Thank you. I think for those who don't know, I had calls with the federal delegation as well as with the caucuses in the state General Assembly to discuss, to listen to their thoughts about our vaccine distribution plan. The federal delegation was on the call. I think nearly most of the delegation was on the call, and asked a number of very helpful questions, made helpful comments. One of the things that I assured some of those on the call was that we will be distributing vaccines proportionate to population across the state so that there's no one that'll get left behind as a result of being from a more rural area, for example, or a more urban area. It's really going to be divided up on population, although there'll be prioritization given to upfront to counties that have had the highest per capita death rates. But that's just in the early number of vaccines that'll come. But it was a good call, and people made suggestions and threw out ideas and thoughts. So that's the purpose of these calls, and I do this somewhat frequently throughout the pandemic. I've reached out to members of the General Assembly, more so than the federal delegation, but to get their input and ideas, and this was a particularly helpful call.
All right, we'll do the last one from Shruti at Bloomberg. The state has spent about $2.2 billion of its CARES Act funding, according to the Comptroller's website. Will Illinois be able to spend its remaining CARES Act funding by December 30th, or do you want an extension from the federal government?
Well, obviously, more time is always better, but we're not asking for an extension from the federal government. And also, you should recognize when you look at those numbers that those don't include the dollars that are committed but unspent. And so, those are things that will happen between now and the end of the year. The reporting won't occur till after the end of the year. So you'll see all of those CARES Act dollars, or nearly all of those CARES Act dollars, committed and utilized. We have needed all of those dollars to do the kinds of things to mitigate the virus, to mitigate the economic damage, to help people who've been most ill affected by the pandemic.
Jordan, Craig had a question.
Yeah.
If that's okay. Today, ComEd principals were in court pleading not guilty to corruption charges. Republicans have upped the ante now, demanding that Madigan not only resign as Speaker, but resign from the House, or if not, testify before the Special Investigative Committee. Do you agree with those calls?
Well, I don't think anything's changed from the moment that they were charged to the moment they were arraigned, right? There's no new information that came out as a result of this arraignment that occurred. And you've heard what my response has been. I mean, the charges that were leveled, the people who were arrested, this is something that's, look, I think you all understand. I really believe that public service is a high calling, and that the integrity of public servants is important for people to understand. And that means that when you serve in high office, you should be willing to answer questions from the members of your caucus, from the people of Illinois, from the reporters and so on, or you shouldn't be in office. I mean, I stand up here every day to talk about anything and everything that gets brought up. I think we've had more than 125 press conferences in the last 8 months or so. And I think that's the job of people who serve in very high office, including the job of the speaker. And so that's my response.
I mean, at this point, it's been weeks since you said that he needs to go before the
Yeah.
media. So should he resign?
Well, as I say, if he's not going to answer the questions, he should. And very importantly, I think that the members of his caucus will be making that decision very soon. So, I think the clock is ticking until the moment when a vote is taken on who the speaker will be.
All right, thanks, everyone.